Welcome to the session, Lisbeth. Okay, Lisbeth and Catherine. Thank you. So in this session, knowing that the production, packaging and transport and disposal of single-use medical devices, we just heard it, is another big emission hotspot within healthcare supply chain, we will explore the role of single-use devices in driving these emissions and how to tackle them by applying the waste hierarchy and prioritizing a circular economy approach. So are you presenting together? So I invite you then also, Catherine and Lisbeth to be both on stage. They are from Ghent University Hospitals. They both have backgrounds as nurses, researchers, and infection control nurses. Over the past year, they worked on a project funded by the Public Health and Environment Department, seeking alternatives to the most commonly used and most expensive single-use materials in healthcare. Welcome, Catherine and Lisbeth. So this is Peter.
Good morning. My name is Lisbeth, and I'm very honored to be here this morning to present our study on tackling and reducing single-use materials in hospitals and medicine. It's an example of trying to do a little bit better, but not good, I'm afraid. It was a project that was commissioned by our Belgian government, who was wondering about the instruments that are single-use instruments that have the highest consumption or are the most costly for hospitals, and if there were some more circular alternatives available. So in our, the fourth, it's an extra, sorry. In our report, we also explore the literature. You find the methodology. Today, we just jump to the results because we have a little bit limited time. So we give you the results of the hospital survey and very limited the results of the 5 items we further looked into, and also some recommendations. But then the report is, of course, much longer. The purpose was, as we said, to look at some more circular alternatives for the single-use materials that are most commonly used. And also here there were, sorry, some items. Yeah. The first blue was the medication cups. So what is mostly used in hospitals were medication cups and cover caps for ear temperature measurement. So that was rather surprising for us, but also very much items that could be replaced by textiles. So when we looked at the amount versus the cost of items, we saw that, for example, the cover caps had a very high consumption, and for cost, the vessel sealing devices were very costly once used and afterwards thrown away as waste. We have chosen 5 items because of several reasons. It's also in the report in the methodology, but they are all an example for other items. For example, all items that could be sterilized to reuse or could be replaced by textiles. So every color was another group, another category. We have chosen the cover caps for temperature measurement because they had such a high consumption. The kidney trays because you have them in all types of materials, plastics, but also paper pulp. The speculum, vaginal speculum, because some hospitals all use reusables, but some are thinking about going to single use even now. So it was important that we could say what is the most sustainable, and the vessel sealing, and we also looked at blankets. For one item, we had a possibility to do a full life cycle assessment. For the other ones, we looked especially at the greenhouse gas emissions of the raw materials, and we based the rest of the life cycle information on technical data sheets and so on. For the one life cycle assessment, I would like to give you the results. So we compared a reusable speculum that was sterilized with steam sterilization and double packaged in a laminate sterilization bag. And we compared that with 3 types of single-use vaginal specula. It was light-weighted plastic, fossil plastic based speculum. The second one was a more heavier fossil plastic speculum, and the third one was a bio-based plastic speculum. So we looked at all phases, and we saw for the reusable specula that the especially the packaging, waste of packaging, but also the packaging on sich had the major impact. Less was the impact of the reuse cycle, so the disinfection, cleaning, disinfection, and sterilization, and that was because this research has been done in Ghent University Hospital, and we only use renewable energy, especially from wind, and we also use the heat of the steam of a nearby incinerator. So we reuse that heat, and that had a major impact on the impact of the reuse phase. When we looked at the reusables, the single-use specula, we saw that especially the raw materials and the waste of the speculum had a major impact. The exception was the bio-based speculum, who has less impact of throwing away. But that was only for global warming. When you perform a life cycle analysis, you have more midpoints. It's a little bit small, so we use the colors. Red is less favorable and green is most favorable. So the reusable is in the first column, and then you have the fossil plastic, bio-based, and the lightweighted but sterilized with ethylene oxide speculum. And you see that when you look at the other midpoints and the endpoints based on those midpoints, that the bio-based speculum was least favorable. So it's not only global warming that is important. So from that part, the recommendations is that maybe it's not necessary to double package all our sterile materials that we use in the OR. Maybe less packaging is also possible. And the laminate plastic is something that in Belgium cannot be recycled yet. It consists of 4 layers of plastic and 1 layer of glue, and it cannot be, it's not recycled at this time. So that's a problem. When you look at the sterilization process, it would be good that hospitals also look at nearby industries who have waste heat to reuse and to not let energy go. So it's also important that we are aware of greenwashing, because bio-based plastics procurement people are sometimes thinking that that's a better solution, and so it's not, mostly. I would give the floor to Catherine.
Okay, I go further with the other items we studied. The first that I present is a kidney tray that's often used for holding and transporting small items such as syringes, instruments, dressings, or for holding waste arising from nursing or medical procedures. We focused on sterile kidney trays, which are generally used in Belgian hospitals. Often the paper pulp disposable trays are used. And if we compare the CO2 emission of the raw materials compared with a reusable kidney tray composed from inox, we see that a reusable kidney tray has only 1/10 emissions compared to a single-use one. So, and that's based on a use of 1,000 uses of a reusable inox, but that can be used more. That if we look at recommendations, from this, the purchase department has a crucial role in optimizing strategies in the hospitals and can stimulate the environmental awareness. So it's advisable to integrate sustainability criteria into the procurement process. And we can advise to use the digital product passport that should be used for medical devices also. Sustainability coordinators or a sustainability team should be integrated in the procurement process, so they have the expertise to make the right choices in purchase of medical devices. Also, furthermore, when we implement more reusable medical items or devices, the capacity for cleaning, disinfection, and sterilization should be expanded. And also there is more research needed on the most sustainable disinfection. So when you reuse medical devices, and they need to be disinfected to use them safely with the patients. But we see, I think it's also in other countries, but in Belgium, there is an expansion of the use of disposable disinfection wipes. So that's also an issue that should be searched for the best disinfection method. The next item we studied was a patient blanket. So you have that also in a single-use version made of polypropylene and polyester often. And we compared that with a reusable blanket, mainly made from cotton or a combination with polyester. You see here also that a reusable blanket has only 1/10 of the emissions of a single-use blanket. And our calculations were based on a use of 90 reuses of a reusable blanket. So which recommendation can we make here? So we can also, for medical textiles, integrate criteria, sustainability criteria for the procurement process. Healthcare Without Harm has already developed such a criteria. You can find them on their website. Also, as a hospital, you have to consider the already available caps, surgical caps, reusable, the reusable surgical gowns or isolation gowns. So in Belgium, they are already available, but they are not implemented yet in practice often. And yeah, also the logistic process has to be adapted in the hospital or healthcare setting if you want to reuse them. And further, we looked also at the cover caps for thermometers. If you want to measure the temperature between different patients, either you have to use a cover cap on a temporal thermometer, or you can also use a disinfection wipe if you use an auxiliary thermometer. So they both have impact. So it's better when you can use a thermometer who do not need additional material, such as a temporal thermometer. So for the recommendation, I think it's important for hospitals, but also for governments to set sensibilization campaigns on sustainability themes in healthcare. And as I already mentioned, disinfection processes should be studied further. And the last item we studied was a vessel sealing device that's used in laparoscopic surgery to seal or cut vessels in an operation during surgery. And you see there are single-use devices, so it's quite a complex device. We wanted also to calculate the CO2 emission from this device, but we couldn't find it on the data sheets of the products. Also, the companies were not eager to share the composition of their devices, so we could not do a calculation. And the materials, the devices, but also the packaging is very huge. There are a lot of packaging and a lot of waste accordingly. There are two options as alternatives for the single use, and that's a reusable vessel sealer. However, in Belgian hospitals, that's not often used because the technique of the vessel sealer evolves rapidly. So if you buy a reusable vessel sealer, yeah, you have to use it a few years, and the technique is evolving very fast, therefore. But there are also remanufactured vessel sealers, and that are vessel sealers, single-use one, who are after use, yeah, it's called remanufactured, but they are tested technically, they are sterilized, so you can reuse the single-use one up to 6-7 times. So the lifespan of a single use is extended, and that gives also a better solution for sustainability. So we can recommend to use more the remanufactured medical devices, but we have to note that the legal regulations are very strict, and it's not easy to make it that you can practically reuse it, because for every single vessel sealer or another medical device you want to remanufacture, it's a strict regulation to follow. And a general recommendation, we need to encourage to pick up the reusable devices in tenders, but they are often not taken into consideration when medical devices are need to purchased. And a last recommendation is that we have to optimize the medical waste sorting in hospitals. In Belgium, for instance, you can recycle the plastic packaging from a lot of devices, from the plastic around Baxter's, the plastic around the lines, but often they are thrown away with non-risk waste, but they can recycle. So in Belgium, we could ameliorate that recycling. And it's important to keep an open mind for new adjustments or regulations. For instance, in the UK, needle bins can be recycled. So in Belgium, they are going to the incineration as risk medical waste. So I think we need to look broad to possibilities to in case of the sustainability. On this slide, you have an overview of the 5 topics we studied. Important is that for the environment and sustainability, we see that reusable option is always the best option. But here I want to note that it's important that the safety of reusable and a single use was the same, because for the safety for the patients, also for the safety for the healthcare workers, that's important that it's always good. Okay, and here I'm to the last slide. We told in a nutshell our study, but the whole report and all the details you can find on the report who's on the website of the Federal Public Service in Belgium, and it's in English, so it's for everyone readable. Thank you.
Thank you. If you can join me here briefly to see if there are any questions for our speaker presenting the study. So we have David. If you can also briefly introduce yourself so the audience know. Yeah.
Good morning. David Erco, I'm an advisor to the Minister of Health for Brussels. And in my free time, I'm a member of the Observatory for the Anthropocene. So my question, well, thank you for the study. I think it will open up reflections in the purchasing department from many hospitals. So it's really important. My question or suggestion is, don't we need to go further? If you take, for example, the thermometers, you present as the best option thermometers, frontal thermometers with batteries. So maybe we should go into the manufacturing cycle of this item, because we know that in most manufacturers items, the production is the most impacting on CO2 production. And also the battery replacement has an impact. So this kind of consideration, so we need to broaden up the scope of the impact of the items we use. So you didn't use in your comparison, for instance, the alcohol thermometer that we were using before electronic. Would that not be a question that we need to raise? What is the risk of using that old thermometer compared to electronic devices versus the environmental impact of glass and alcohol versus lithium and whatever you have in thermometers? And on the other side, on waste management, we know that recycling plastic at the moment is mostly downcycling and not same level cycling. So also in the waste management, do we have cycles of plastic use that makes it useful to recycle instead of just burning it straight away and making heat of it to use it? So those kind of questions need to be asked in future research. I don't know if you have been in that direction and excluded it for the moment.
Yeah, of course, it's just a first study, an exploratory study. So there's a lot to do more, but the focus of the study was about the single-use materials, not about waste. And we could not go that way. That was from the Federal Public Service. They asked us to focus on that part and not on the waste part. And about the temperature measurement, of course, you had mercury thermometers in the past. I don't know what was the reason to leave that, but I thought it was...
Well, yeah. I think with mercury, mercury is very potent neurotoxic chemicals, and so I think it's a good thing that we were able to get rid of mercury. But if we
Yeah.
follow, you
Thank
know, Maria recommendation or thinking like broader, then instead of going back to mercury, what could be a solution that,
Yeah.
you know,
Indeed, we
but
have
yeah,
to
we wouldn't recommend to
no,
go back to mercury.
but
But we started a study with, it was focused on single-use items, and from the procurement list of the hospitals, the cover caps were the most, one of the hugest consumption. So that's why we focused on the cover caps of the additional material, but we did not study the device, the thermometer as such. But yeah, that's another study, interesting study.
Thank you. Is there any other questions for our speakers? Yes, middle of the room. We can get him a mic. If you can briefly introduce yourself.
Yeah, I'm Miguel Diaz Cacho. I'm from Sergas, the health system in Spain. So I had three questions. First, thank you for your report, which I will really read. I wanted to know where does the number of users come from? Because I think that probably really affects
The number of uses of the blankets and the number of uses of the kidney trays were from the data sheets. So
Okay.
we use that number to do the calculations.
and for the vaginal specula, we it was based on it wasn't included in the data sheet, and we used literature, and we did also a scenario analysis to look at when it could only be used 50 times or 1,000 times, what would be the difference. It's also included all the results in the report.
And also I wanted to know about if you, maybe it was there, but about the water consumption regarding the sterilization, was that included?
Yeah, the water consumption was one of the midpoints, and I'm not, yeah, I don't know it by heart, but indeed it was included in the LCA. Yeah, you can find the results. Yeah.
And the last one, did you consider like not having an incineration plant nearby to use the heat for sterilization?
We did also a scenario analysis when we couldn't have that type of heat, and it was less good for the. It was still better than most of the disposable specula concerning global warming, but I think the bio-based, only concerning global warming, the bio-based was a little bit better then. But we had to use, so we used the eco-event database, and we used steam from the chemical industry. So you have to choose. So that's not really the same as you would make the steam yourself in the hospital, but it was the best
Okay,
we could use in our scenario.
thanks.
Yeah.
Okay, we could ask a lot of questions about the study and comment further, but we have to close this session here. Many thanks again to our speakers.